cholera outbreak in years, with war and displacement worsening the crisis. Doctors Without Borders, Médecins Sans Frontières, also known as MSF, reports treating over 2,000 patients and recording 40 deaths in just 1 week in Darfur alone. The outbreak has now spread beyond camps for the displaced into multiple towns and villages, overwhelming fragile health facilities. To discuss the situation and what's happening on the ground, we're now joined by Solomon Cila, who's the project coordinator for Doctors Without Borders in Sudan. Thank you so much indeed for joining us, and welcome to the program.
Thank you. As you said, my name is Solomon Cila, from Nyala in South Darfur.
Could you start by giving us an outline of the current situation in terms of the outbreak across Sudan, particularly in Darfur? Just how bad is it compared to previous years?
Okay, at the moment, Sudan is facing severe and escalated cholera outbreak with the South and Central and North Darfur, as well as Blue Nile State, that is highly affected by the current outbreak. And we do see alarming situation in Tawila, North Darfur, where about 380 people have fled from the fighting from El Fasher. And this is also as a result of the overcrowding in the camp, with the little access to clean water, sanitation, and adequate shelters. So since August 2024, the Ministry of Health has reported over 99,000 cases and more than 2,400 deaths in just 1 week. And MSF facilities in Blue Nile and Darfur has recorded about 43 deaths and treated more than 2,400 patients.
Are you fearful that the situation will get worse before it gets better, given you're in the middle of war and seasonal rains?
Yeah, Médecins Sans Frontières do see that with the current conflict, the situation will get worse because the conflict has destroyed essential infrastructures like water, sanitation, and healthcare facility, and has forced really millions of people from their homes, and now they are in these concentrated camps, which is crowded and with the very limited facilities, sanitation facilities, and also there is lack of water in these camps, so they have no access to safe drinking water, and they are forced to take water from contaminated sources. So we do see that this is not going to really get better soon, because also we have witnessed also here in Nyala, the destroyed water stations has resulted to people going to fetch water from contaminated sources, which is completely unsafe. But I know that there is effort by UNICEF and other actors to rebuild this water station, and now it's starting to get up, but I don't see the situation getting better soon.
And on top of that, we believe that malnourishment is another big thing that you're dealing with.
Exactly, malnutrition is one of the deadly consequences of this crisis. And as you know, hunger weakens children immunity, and children being the most affected in this crisis, when they leave their families and move into these concentrated camps, there is no food, there is no water, and children are vulnerable to this. And this has also accelerated them getting dehydrated and pushing them to be fragile, that get their body fragile and vulnerable to getting cholera easily. And this also, we see that children always arrive to our facilities severely dehydrated, and most of the time, our health workers, they struggle to get them back to life. But it's really concerning that malnutrition is also one of those factors that we need to address in this crisis, and on top of the cholera outbreak.
Solomon, we're going to have to leave it there, but thank you very, very much indeed for that update. Let's hope that all these people get the relief that they need and that the situation turns. Thanks so much indeed for that update.
Thank you.